Hello, I'm Chrissy, and today we're going to talk about accessing, caring for, and de-accessing portacaths. So the first question when your patient presents with a portacath is, why is the port there? If the patient is currently receiving chemo through this port, then we should be calling the oncologist for this patient and getting permission to utilize their portacath. We do not want to mess up a port that may be used for that specific reason. Another thing we need to do is get a chest x-ray for our patient, because any patient that presents with a central line, we need to make sure that the central line is in the appropriate space, and that includes ports. We should ask our patient what size and gauge needle they use, and we should also ask them whether or not it is a power port. The patient should be able to tell you this information. If not, you can tell from the chest x-ray whether or not it's a power port. Here are a few examples of what they look like. On the back of the port, it usually has a radiopaque CT engraved into it if it is in fact a power port, and you can see that on the chest x-ray with the little radiopaque CT there. So that is a very important piece. From here, I'm going to grab the appropriate size and gauge needle. And if it is a power port, I'm going to grab the port needle that says power, PAC on it, and it has a blue tubing associated with it with a yellow clamp. The non-power port needle has clear tubing and a tan clamp, so we would not use this if it's not a power port. We'd use this if it's not a power port. I'm going to gather my supplies, which would be my port kit, my needleless connector, which is usually in your med room. Okay. And I'm also going to grab my Kuros caps that I'm going to place on the end of my port and on any Y sites of any of my IV tubing that I'm using for this patient. So I like to first assess the site for any redness, signs of infection, swelling, tenderness, anything like that. If the patient gets their port accessed frequently, they will essentially probably have either some keloid scarring or a scab over the site. I'm going to open up my port kit and I'm going to use it as my sterile field. I'm going to take my needleless connector and I'm going to aseptically dump it into my port kit. As well as my port needle itself, I will also aseptically drop it into my kit. There's a mask on top. Mask is for you. You will wear the mask when you do this procedure. The patient should be able to turn their head away from the site. If they cannot, they will also wear a mask. Apply my mask as well. Next in the kit is our hand sanitizer. I'm going to perform hand hygiene and make sure that my hands are clean before I start this procedure. After that, I'm going to grab my sterile gloves and I'm going to don my sterile gloves, remembering to grab the cuff of the first one and under the cuff of the second one with the sterile gloves. So non-dominant hand, I'm going to apply my sterile glove without contaminating my gloves. Next, I'm going to grab my next glove under the cuff and I'm going to apply my glove. Anyhow, now that I have that, I'm going to take my sterile drape from the top. I'm going to apply it underneath of my port site. I usually like to tuck it into the gown so the gown doesn't come up around the site. Next thing in the kit is my alcohol swabs. I'm going to take my alcohol pads and scrub the site for 10 to 15 seconds, just getting that first layer of dirt off of that site for that patient. If the patient has a lot of chest hair, use your clipper and clip before you start disinfecting the site. Next thing is my chlorhexidine swab sticks. There are 3 chlorhexidine swabs in the kit. If the patient has an allergy to chlorhexidine, we are going to use the povidone iodine swabs. We will scrub for 2 minutes. With the chlorhexidine, I am scrubbing the site for 2 minutes. Since I have 3 sticks, it will be 40 seconds for each one. Up and down, side to side, 40 seconds. I discard this one. I move on to the next one. Again, up and down, side to side for 40 seconds. Remember, 40 seconds is longer than I'm scrubbing. This is for demonstration purposes. Please use a watch with a second hand or your clock so you know that you're scrubbing for that entire 40 seconds. So we have a total of a 2-minute scrub. When I'm finished with that, next thing I'm going to grab is my Cavalon, which is a no-sting barrier film. This protects the patient's skin from breakdown and also from the adhesive harming them. I'm going to go around the site and I am going to use the Cavalon to make sure that I am around where the dressing would be applied so that the dressing does not harm the patient's skin. While I'm allowing that to dry, which could take up to a minute, I'm going to take my port needle on the end as a cap. I'm going to remove the cap. I'm going to discard that. Next is my needleless connector. There's a small cap on the bottom. I'm going to also remove and discard that. I connect my 2 pieces together and I grab my first flush. There are now sterile flushes in the kit. I do not have to grab flushes from my med. I remove the cap and I'm going to prime my needle and catheter. So prime till saline comes out of the end. And then I'm going to take the first part of my dressing, which is the CHG patch. Again, if your patient has an allergy to CHG, we are going to not use the CHG patch for the patient, and we are going to note this in our documentation. You'll notice that the CHG patch has a number 1 on one side, number 2 on the other. So guess which one I'm removing first? Number 1. I peel off the number 1. This is not sticky on this side. We don't have to worry about that. I take my port needle and I'm going to put it inside the slit. I can put it up or I can put it down, however you are comfortable. Don't do it like that. So then I'm ready to go. Again, number 2 will go against the patient's skin. Notice how there are little tabs here and you have your gripper on your needle. The gripper is what you're going to hold when you access. So I'm going to wrap my little tabs around my gripper and I'm going to grab them all together so I have it like a little taco. I'm going to remove the sheath off the end of my needle so I'm ready to access my port now. I like to put my fingers on either side of the port since I'm wearing sterile gloves. That's appropriate. And I'm going to aim for the center of the port. I'm going to press the needle into the port until it doesn't go anymore. Do not push it in super hard. I don't want to bend the end of my needle. From here, I'm going to grab the tips of my CHG patch and the number 2 behind it. And I'm going to remove the number 2 so that my CHG patch sticks to my patient appropriately. There we go. Now I'm going to remove number 2. I'm going to press it down to make sure it sticks to the patient's skin. From here, I am going to remove my little gripper by squeezing it like a clothespin and taking it off, and we discard that piece. I'm going to then pull back on my flush, making sure that I have blood return. If I do not have blood return, I can reposition my patient by either laying them back or sitting them up and or raising the arm on the same side as the port to see if that helps with the positioning. And I will pull back again to get blood return. If I get no blood return, I do not access or use this port. Okay, since I have blood return, I'm going to flush in a push-pause method. Push, pause, push, pause, push, pause, until my entire flush has been instilled and my port is completely flushed. I'm going to lock my lock unless I am hooking them up directly. From here, I'm going to make sure I put my dressing on. So I have a big Tegaderm dressing. You'll see I have 1 little notch here on the bottom, or on the top I have 2. So I'm going to put the single notch to the bottom. I'm going to remove the paper backing from my Tegaderm, and I'm going to apply it so that my tubing here lines up with my little notch. I'm going to apply this. It is going to be tented out a bit because the port needle does stick up off of the chest. I make sure that I am sealed on all 4 sides. And from here, I'm going to grab this little round piece, which is a piece of paper, and I'm going to remove the paper surrounding the tegaderm completely, making sure that I'm sticking on all sides and I don't have any bubbles on the edges. Next piece here is an extra piece of tape here. I'm going to remove this from the paper and I'm going to place it underneath of my current dressing. So I'm going to place this underneath here by overlapping the very bottom and making sure that I am sealed from the bottom. From here, I can either draw my labs or hook my patient up. If I'm going to draw labs from a port, I need an order that says it is okay to draw my labs from a port. I absolutely cannot draw blood cultures from a port unless I am specifically asked to do so, as if this port is infected, then they will come up positive. I would make sure also that if I'm drawing labs from my port that I use my Lorlock vacutainer adapter and I draw my PTT last, as there is sometimes heparin in the port and that will give you a false high PTT in that case. From here, I should hook my port up to some IV fluids running at the prescribed rate. If I do not have IV fluids ordered, I would get an order for a KVO, a keep vein open rate, which would be 10 to 30 milliliters per hour. Don't forget to please mark your port with the date, time, and initials, and we apply this to the side of the port as well, so we know who and when this was accessed by. If you are unhooking your patient from your port because they're going to a test or they need something else, please make sure that you use 2 hole flushes, push, pause, and you lock the lock on here, as our needleless connectors are neutral pressure. We don't want blood to back up into the port and clot off. We also have an extra piece of tape here if this hangs too low, that I can use this piece of tape to corral this little guy. So I'm going to pull the backing off the tape and I can put this with my dressing on the side of the dressing, however you would like, but I want to make sure that this is taped so it doesn't flop around or get pulled out. The port is good for 7 days as it is. The dressing change does not happen on Mondays like central lines. I would do the dressing change after 7 days. I would remove the entire dressing, de-access the port, and re-access with all new equipment, including the needle. When my patient is ready to be discharged or I have to de-access, I am going to flush again, push pause with 2 hole flushes. If the doctor chooses, they can order a heparin flush. Heparin flush should be ordered as a PRN order in your MAR, and the heparin flush is available in your Pyxis in a large syringe, and it has 7 milliliters of heparin and saline mix. With this, I would flush this last before I de-access, only if the physician orders it. From here, when I'm ready to de-access, I'm going to remove my dressing. And I'm going to gently remove my dressing, remembering that my patient may have some sensitive skin. I remove my dressing all around the sides. I like to do the sides and then do the center, but you want to be careful that you don't pull the needle out by accident while you're doing this part. From here, when I'm ready to de-access, I'm going to use my fingers on the white triangular part at the bottom, and I'm going to pull the top piece, which looks almost like the top of a soda can. I'm going to pull back till I hear that click, and then I can remove my needle. You will see that this is where I would place my fingers, and this is where I would pull back on to remove that. This goes into a sharps container, and then I can remove my dressing, my CHG patch as well, and either start over again if I'm re-accessing, or I'm going to put a little piece of gauze over the site because I may get a drop or 2 of blood from that site. There should not be a significant bleeding happening. I'm going to document the removal, and I am going to make sure that the site is good for my patient. Thank you.